AlterNative Birthingways. Present.
We have to start right here.
No, we just did it. That's fine. Let's take out of that.
There it is.
No, we're doing it through here, screen share.
Welcome to AlterNative Birthingways, presented by Tisicali Yawali as part of the Mujeres de Maiz Spring 2015 event series. Thank you for joining us. We would like to start by thanking the women's group Mujeres de Maiz.
It's playing.
Oh, it's delayed.
For inviting us to participate in their spring series and for inspiring us to create new workshops and resources for our beautiful community. We would also like to thank all the other wonderful women who are collaborating in this series. Your wonderful contributions are greatly appreciated. We are Tisicali Yawali, and our name is Nahuatl for the Circle of the Home of the Healer. Our collective is rooted in community building to integrate new healing modalities with ancient practices of this continent, Anahuac. We began in 2008 as a birth worker collective, and throughout the years, we have been able to provide mother support groups, low-cost doula services, childbirth education classes, workshops on a range of women's health topics, as well as fundraise for our own education and training as birth workers. We will now introduce some of our members who will be presenters for this webinar.
Hi, my name is Maria. I am a full-spectrum doula, artist, and student midwife.
Hello, my name is Marta Escudero. I'm a womb-to-the-tomb doula and a mother as well.
Hi, my name is Sara Margarita Martin, and I am a cultural worker, as well as a mother.
And I am Sipakli Oslahun, and I am a mother, artist, and advocate for the preservation of traditional Indigenous culture.
We want to begin by sharing this quote. Birthing is an extremely physical and spiritual act that requires endurance, determination, concentration, and yet a certain surrender to the natural process. This quote is written by Patricia Gonzalez of Red Medicine, Traditional Indigenous Rites of Birthing and Healing.
Before getting started, we would like to provide a quick overview of the content of this webinar. The objective of this webinar is to provide our community with helpful information that can be used when creating a personalized birth plan, and to create a forum in which this topic can be explored. We hope that families are able to use these resources to make empowering choices according to their own needs and accessibility. In this webinar, we will review the basic birthing options. The main topics we will review are birth locations, birth workers, birthing ways, models of care, and we will also briefly review some ancient and contemporary Indigenous traditions and practices in accordance to our experience and what we have been taught in our Red Road spiritual journey. At the end of the webinar, we will have a question and answer dialogue with the presenters. You can also join our community forum on our blog in regards to this webinar at tisicali.blogspot.com. Once more, thank you for joining us, and we hope that you find the information useful as an additional resource to your independent research. Our collective, Tisicali Yawali, is always expanding our knowledge and encourages you to do the same. Make empowering choices by informing yourself. Look for sources that resonate with you and also use your intuition. At the end of this webinar, we will share resource links, books, handouts, and we will also share tips for conducting your own birth choice research. So if you miss any information, there will be tons of ways to catch up and expand your awareness.
With an open heart, we feel very humble in sharing this information with you. The following information is coming from a Mesoamerican cultural content. We are all Indigenous women from the Nahua and Mayan regions. We would highly encourage for you to do your own research and find out what your own traditions are, as they vary by region. We will start with birth locations. We have identified 5, and they are hospital, hospital-partnered birth centers, freestanding birth centers, temazcali, and home.
Hospitals.
The maternity care system in a hospital setting serves pregnant people that are low to high risk. The technology tends to be very high-end, which is helpful in managing a high-risk pregnancy and birth. Most hospitals have access to surgical equipment should you need a cesarean birth. The amenities vary by each hospital, so please check out your local hospitals to see the type of amenities that are available in your area. Some of them can be beds that are mechanically altered to sit upright and pull apart for ease of the care provider during the pushing stage in birth. Here in Los Angeles, we have 2 hospitals that offer water births. Some of the comfort measures that you may find in a hospital setting may be birthing tools such as birthing balls, handrails for upright births, mirrors to see what is happening in your birth, as well as showers.
Birthing centers.
Birth centers are birthing facilities where the technology ranges from low-tech to high-tech, and they monitor or manage pretty much healthy pregnancies. The birthing rooms range from high luxury suites to very homey feelings, and the birthing beds are standard beds like you have at home, or some provide also hospital birthing beds that can be pulled apart. There's 2 different types of birthing centers. One is hospital partner birth center, which is directed by actual hospital, and as long as it's consistent with birth center standards, it can be housed within the hospital or out in an outside facility as well. There's also the freestanding birth center, and it's not associated with any hospital, but should you need a cesarean, you will be transferred to the nearest hospital. A lot of the comfort measures that birth centers have access to are things like birth balls, a lot of very natural methods for labor. They allow a lot of movement and a range of labor positions.
Home birth. Parents that choose home births tend to be highly screened by midwives, so only healthy pregnancies and low-risk births are candidates for home birth. However, should you need a cesarean birth or medication, you may be transferred to the nearest hospital during birth. Because home births involve much more planning and preparing for the birthing team, the birth room will look however parents choose to have it. They may plan to make it an exceptional birthing room and rent equipment such as birthing pool for a water birth, or it can stay like the bedroom would normally look like. For home births, the birthing tools that are accessible are really up to the parents to choose from. You may be able to use birthing balls, or also hang a rebozo tied between doors and doorways for support in upright births. You may choose to make altares or focal points, or choose very minimal birthing tools and more emphasis on movement, labor position, and internal focus.
Temazcali. Temazcali birth is a traditional Mesoamerican practice that takes place in an earth-based cave or home-like structure, and they are conducted by a midwife or experienced traditional birth attendant. Temazcal births are not recommended for high-risk pregnancies, and they are not the same as sweat lodges. They are much more gentle in terms of heat, and the water poured has medicinal plants and herbs that facilitate the labor process. Depending on the availability of a birthing temazcal, the physical space may be either earth-based, seats around the walls of the temazcal, or flat ground with the center being a source of gentle heat where hot volcanic rocks are placed and water is poured for a gentle steam. As far as comfort measures, the birthing tools available in the temescal is the smudging that helps to ground, the herbs in the water poured and offered as tea, and the grounding that is offered by being in the earth and in the darkness in prayer and song. We would like to note that this birthing way is recommended only for people who have a healthy and low-risk pregnancy, have an experienced and qualified birth attendant, and a birthing mother and both parents are very familiar with the temescali and the red road ways.
Now let's go ahead and talk about birth workers and care providers. We have identified 5 types of birth workers. They are childbirth educator, birth doula, midwife, traditional birth attendants, and OBGYNs.
One of the first birth workers you would encounter is a childbirth educator, and they provide a lot of education and information regarding the whole birthing process, comfort measures you may use, the different birthing facilities and birthing technology and exams that go on before, during labor. They also provide a lot of support for partners and a lot of education for the parent itself. And depending on what childbirth educator you choose, which you can read their outlines, see what information they give. A lot of them also give breastfeeding education, baby care education, and how to comfort you, especially your newborn. For new parents, it's very important. There's also the birth doula, which is a professional. There's a wide variety of doulas, but I will focus, because the webinar is on the birth doula, which is a professional labor support that provides emotional support as well as prenatal education and preparation. They have a variety of comfort measures they can provide. A lot of them have different specialties and tools. So again, look over their profile and see which one fits your birthing style. You may interview them beforehand as well. They give also a lot of support for the partner. The doulas are very important in the birthing process as well, because they're your advocate at your birth as well. And prenatally, they could go over your birth plan, see what sounds better for you, and preparing you for the birth.
Midwife.
The benefits of hiring a midwife to be your care provider are holistic midwifery care that is personalized and unique to meet your needs. They provide emotional support, spend more time with you during the prenatal sessions, provide excellent continuity of care, as well as well-personed gynecological care. They also have access to referrals should you need additional support.
Traditional birth attendants.
Traditional birth attendants are persons trained in traditional midwifery care that is culturally specific to their community. In terms of pregnancy health, they have access to traditional ways of healing and treating the pregnant people in their community. They train with a traditional midwife that can be someone in their lineage, as well as the midwife in the village, the elder. Please note that this may not necessarily be recognized by a medical board in that specific country, but this does not mean that they're uneducated. It just means they have a different way of learning to be care providers. They serve families that are having home births because that is the cultural norm in their community. The benefit of having a traditional birth attendant is that they provide culturally competent care.
OBGYN, a physician who specializes in obstetrics and gynecology. Parents who choose OBGYN, doctors and physicians, tend to be from very low to high risk. OBGYNs obtain their licensing after completing a formal education and residency certification by the American Board of Obstetrics and Gynecology. OBGYNs tend to practice in hospitals, but some also do home births. Some of the reasons why people choose OBGYN is because care is provided or approved by most insurance companies, including state insurance plans. They also specialize in high-risk pregnancies and can perform cesarean births.
Another alternative birthing way is the unassisted birth, or also known as free birth. And this is recommended for healthy, low-risk pregnant person that knows and trusts their body and the birth process. There's not a licensed care provider, but parents and birth team, we advise, should have extensive knowledge and training for emergency birth scenarios and have backup for hospital transfers should there be an emergency. The birthing location is usually in a home in a very intimate setting with very few people there. And again, there's no doctor or medical professional or birth attendant present. There's a lot of benefits or reasons and motivations why people have this, but we will highlight two common ones. One is the belief that birth is normal function of the female body and it's not a medical emergency, so there's no intervention required. And it's done by people that are very knowledgeable of the birthing process and feel safe and supported in a very supported environment. And another reason is that parents are unable to find a practitioner in their area that can attend their desired home birth. And this may be due because they cannot afford a practitioner or because there just isn't any in their area. This reason is very troublesome because they may put mother and baby at risk. And that's why we advocate for birth attendants to be trained everywhere and for there to be coverage available for this birth, any birth desired, especially home births, since they're more affordable for us taxpayers. And it shouldn't be a problem. There should be medical coverage for every single birth desired.
Transitioning into our next section, we would like to share a quote by Patricia Gonzalez, author of Red Medicine. Birth, like native ceremonies, requires preparation of body and spirit, a preparation of physical space, entering into an unknown dimension that is largely not controllable by human intervention.
We want to preface that no matter what kind of birth you want or have access to, you have everything in your ability to make your birth an empowering and beautiful experience.
We will explore 3 birthing ways. They are vaginal birth, cesarean birth, and a VBAC, or vaginal birth after cesarean.
We have identified 4 variations of vaginal birth. They are unmedicated vaginal birth, medically induced vaginal birth, technologically supported vaginal birth, as well as medication-assisted vaginal birth. Unmedicated vaginal birth is a vaginal birth in which little or no interventions are used, and the pregnant person is more active in using intuitive ways or learned ways in order to manage the surges, also known as contractions. This is usually accomplished when mother is in a healthy condition. There is physical and emotional preparations and support for this type of birth. These are just a few ways you may manage sensations of surges, also known as contractions, without using medications. There are many more, so please do research on which may be best for you.
The following charts display 2 different emotional aspects of birth. 1, fearing birth. 2nd, embracing birth. Here are some comfort measures for an unmedicated, unassisted vaginal birth.
Breathing is key in labor. Air is important in labor by providing oxygen for you and your baby. There are many breathing techniques, all include slow and light breathing. By taking a deep breath at start of wave or contraction and exhaling at the end may be very helpful in staying grounded in your labor. You may be guided by your birth partner, your doula, or whoever's present at your birth. Touch is also very important. According to health.com, there are many health benefits of touch, anywhere from lowering blood pressure and heart rate to increasing the immune function and relieving pain. A light touch, a hug, and a firm or light massage in key areas are very beneficial in helping you to counter the pressure that you may be experiencing in your body.
Medically induced vaginal birth.
So medically induced vaginal birth, you use medication to begin labor before it begins on its own. And this is usually done at 39 weeks or after. Because of its risk, we only recommend it for health reasons. Some of the common reasons for induction are post dates, meaning the expected due date, but it varies from provider to provider. And this is a reminder that expected due dates are not expiration dates, and usually providers should give you leniency in this. Another common reason is preeclampsia, which is high blood pressure during pregnancy. And a lot of the common medications used are prostaglandin, which is used in gel formed on the cervix to help ripen it. And it mimics our own hormones. It does, however, have side effects, which are nausea, vomiting, diarrhea, and infection and fever. Another very common one used is Pitocin, which is a synthetic oxytocin a hormone that we naturally produce in our bodies during birth. It jumpstarts uterine contractions. This is administered via bloodstream through the IV. And because it goes through IV, you won't have mobility once Pitocin is administered. You have to be bedridden. There's a lot of also just restrictions in eating and drinking. And the contractions are much more intense than natural ones. And this usually is very difficult to manage by mother since they're very, very, very intense. So they usually, after Pitocin, they would need medically assisted vaginal birth as well.
Medically assisted vaginal birth is pain medication used in hospitals. Since there are many known side effects to the birthing parents and unknown side effects to the baby as well as the birthing parent, we suggest only to use these tools when you have exhausted non-drug coping methods and birthing parent is unable to rest. Some of the common types of pain relief medications are, first, epidural. For the epidural, an anesthesiologist would insert a needle into the spine area surrounding the spinal cord and uses a catheter to continue to release small amounts of medication. The regions of the body affected by this medication are usually the lower back, abdomen, and leg. The side effects are for birthing parents: itching, nausea, fever, low blood pressure, sedation, difficulty emptying bladder or bowels, the use of other interventions, also known as the cascade of interventions, and affects ability to push baby. Also, this can include postpartum headache, backaches, pains in the area of injection that may last weeks. The second type of pain relief medication is narcotics. This would be administered by IV or injection directly into the muscle. This pain medication allows birthing parents to still feel the peak of contraction and to be able to have the ability to push. However, you are still confined to a bed usually if you have narcotics administered. The side effects of narcotics are sleepiness, lethargia, nausea, vomiting, itching, dizziness, confusion, and difficulty breathing. It's important for us to connect how the use of Pitocin may ultimately lead to different types of medical practices that may need to counteract each other, known as the cascade of interventions. In the graphic here, we describe how Pitocin's really harsh contractions that you may feel synthetically may require the use of pain medication or pain relief to sedate some of that powerful contraction. Now, when the epidural is now administered, you may not feel the contractions as strongly as you would, but the Pitocin is still acting and the contractions are still coming, and your baby is feeling the strength of these contractions. To make sure that the baby does not go under distress, forceps or vacuum extractors, which are more medical tools, may be used to try to assist in pushing the baby out. And if those two are not successful, the ultimate decision would then be to have a cesarean birth. So it's very important to note that if you are choosing to use Pitocin, or if you are being advised to use Pitocin by your doctor, and the contractions are very strong, please let them know. And also let them know if they can lower your drip. It is possible that they can do this if the pain is just way too strong and you know you don't want to go this route. Now, some conditions do require the use of Pitocin, but try to find out first before you consent to the use of Pitocin whether it is absolutely medically necessary to use.
Technologically supported vaginal birth. This is when instruments are used by care providers during the pushing stage to assist the baby and to pull baby out of the birth canal. This is usually recommended by providers when the pushing stage is prolonged, and this varies depending on your birth location, your care provider, and also the condition of the mother and baby. And these instruments are more likely used by women that have had an epidural. These often come with an episiotomy, which is a small surgical incision on the perineum, which is the area between the vagina and the anus, and this is to be able to enlarge the vaginal opening. There are two main types of instruments that are used, and these are the forceps and the vacuum extractor. The forceps are long steel curved tongs that are placed into the vagina and around the baby's head. The vacuum extractor is a silicone suction cup at the end of a long handle. The caregiver then attaches the suction cup to the top of the baby's head. There are some risks, however. For babies, it could be scrapes, bruises, and swelling of the head and face. And other rare risks are eye trauma, skull fracture, bleeding within the skull, and seizures. And for mothers is injury or stronger pain in the perineal area.
Cesarean birth. According to the International Cesarean Awareness Network, 1 in 3 births in the United States is a cesarean delivery. Cesarean birth is a major abdominal surgical procedure where the surgeon cuts a woman's abdomen and uterus. A catheter is used to collect uterine, and the baby is taken out by hand, forceps, or vacuum. Because of its side effects on both baby and the pregnant person, this should only be performed when vaginal delivery would put baby's or the parent-to-be's life or health at risk.
VBAC, acronym for vaginal birth after cesarean. A birthing parent who has been able to deliver a baby vaginally without surgery after a previous cesarean. According to ICANN, the primary concern for birthing parents in discussing VBAC is uterine rupture. Now, uterine rupture can be a life-threatening and serious issue. However, the risk is very rare, affecting less than 1% of birthing parents who attempt a VBAC. Things to consider for VBAC candidates. What is your suturing type? Is it a single or a double? What is the condition of your scar tissue? Does it need more healing? How long has it been since your previous cesarean? Generally, VBAC candidates are best successful at VBAC 2 years after their previous cesarean. Ask these questions to your provider to know if you're a great VBAC candidate.
Transitioning into our next section, we would like to share a quote from the Boston Women's Health Book Collective, Our Bodies, Ourselves for the New Century. You can envision your labor and birth, imagine it, but you can't plan it, nor plan when it will happen. However, you can plan the kind of care you want. Moving forward with models of care, we will review two models, the technocratic model and humanistic model.
Models of care. Models of care are frameworks that inform birthing philosophies, choices, and care providers that may be common within that particular care type. Here is a quick summary of the three models of care. The first is the technocratic model. The technocratic model is actually a term used and created by Robbie Davis Floyd, who was an anthropologist that explains the growing and more influential model of care in the US that relies heavily on the use of technology as well as bureaucratic system. This refers to the industry of birth. The birthing locations that tend to practice this model are often in hospital settings as well as some birthing centers. Care providers that tend to practice this model of care are OBGYNs and nurse midwives, physicians and care providers that are trained in dealing with the hospital technology. Things to consider about this model of care. The use of technology helps to monitor high-risk factors that may not be necessary for all types of birth. However, this model of care tends to be the most accessible to low-income families as they accept most state insurance plans as well as private insurance plans. This model of care tends to restrict choices of movement and physical positioning because of the wired nature of the technology. It may also include a patient-doctor relationship where birthing decisions may be influenced by the use of technology and/or doctor's authority.
There's also the humanistic model of care, which involves some technology to assess risk at birth. However, this one is largely driven by a sense of humanization of the birthing experience, and it promotes the birth as a biological experience. And so it involves a lot of movement and natural force, such as gravity, for an optimal birthing experience. Some of the birth locations that offer this are some hospitals, birth centers, and home births. The care providers may be OBGYNs, nurse midwives, licensed midwives, and doulas as well. And other things you may consider is the spectrum are both technology and less invasive methods to promote this biological experience, so it's much more flexible. It's also very accessible to low-income families. It has a lot of similar facilities to the technocratic institutions, and all these decisions on birth are balanced between what the parents wish and also evidence-based protocols. So it has both models for you to choose from.
Alternative birth traditions. Out of the many cultural traditions that exist within Mesoamerica alone, we chose 4 different types of birth traditions that may be used in an urban indigenous context. The 4 are creating sacred space in birth, welcoming ceremonies, Tonalpuali and Tonalama cuentas, as well as honoring the placenta medicine. To create a sacred space in birth, it is important to connect with yourself and your surroundings, to feel present, tune in with your body and your baby, check in with your birth team, as well as clear the energetic space. If it is possible, try to assign one person in your birth team to make sure the energy of the space of the birth room continues to be in line with the intentions and the integrity of the spirit. Welcoming ceremonies. There are many ways to celebrate the birth of your baby. One way is to recite your own creation story or birth story. You may choose to offer a space for Insochirincuica, for song and prayer. You may also, and this is the most common way, You may also choose to present your newborn and infant to the 4 directions. In Dansa, this practice is used, as well as corn baths. You may also choose to present your baby in the Temescali space, and there are so many ways that you can celebrate through other ceremonies that you can create for yourself. The Tonalpuali and Tonalama systems are calendar systems that are used to measure day and time, as well as the energetic rhythm of space and time. With this system, you may be able to calculate the gestation period of your baby, or you may also be able to consult a daykeeper and offer the due date that your provider has given to you, and also kind of estimate the time frame when your baby may be coming. This can help you to begin to welcome the kind of energy your baby will come with. For more information on this, we will be providing resources in the blog site on this specifically, because it gets into a lot of detail and calculation. But we hope this bit of information helps. Honoring the placenta medicine. Choosing to keep your placenta is your right, no matter if you have a home birth, a birthing center birth, or a hospital birth. If it's important for you to keep your placenta for religious and cultural beliefs, please state so. You may be asked to write it in a birth plan, tell your provider verbally at the birth, or you may be asked to sign a release form. Whatever the case, if it is important for you, know that you have every right to keep your placenta. And there are many options for how you can honor your placenta medicine. Traditionally, in Mesoamerica, the placenta would be buried either nearby the home, planted with a type of plant or tree. And now, more commonly, we are finding that there are many other ways to honor our placenta medicine, whether that is through placenta print and birth art, as well as ingesting your placenta medicine. And there are many benefits of doing so. This can be done through placenta encapsulation, as well as other ways to ingest, such as smoothies and cooking the placenta. So it's really up to you to choose how you want to create a ceremony or a sacred space around the use of your placenta medicine.
We want to affirm that whether you have an unmedicated, technologically assisted, or even a cesarean birth, you are still undergoing a rite of passage into parenthood. The most important thing is to birth with dignity and respect.
Here are some tips for an empowering birth. No matter what your birth team or your birth setting, you have the right to birth with dignity. Seek information and wisdom about the birthing process. Avoid exposing yourself to birth horror stories. Remember to maintain flexibility and keep grounded under unforeseen circumstances. Remember that a strong support system is key for a positive birth experience. Choosing birth locations, care providers, and comfort measures that are best for you is very important as well. And also owning your birth experience to the fullest. To finalize, we would like to offer the following quote.
A great affirmation at birth is to think that so many women before me have given birth, and in that energy, I trust myself in body and spirit to birth.
We have reached the end of our webinar, AlterNative Birthingways. We hope that you enjoyed our presentation and that you found the information useful. As we mentioned in the beginning of the webinar, we will continue the dialogue on our blog. The address is on screen. It is tisicali.blogspot.com. Before opening up for a question and answer period, we would like to present to you our community slideshow. And we would also like to say thank you to all of you that submitted photographs. Thank you for sharing those beautiful and sacred moments with us. We hope you enjoy this.
Hello. Are we live? Yes. Hello. We are open now for our question and answer period. So we are ready to answer any questions or hear any comments that you'd like to share with us today. So here we are. Marta, Sara, Maria.
Sipaki.
Sorry, Marta, you could say your own name. Sorry about that. So you're welcome to use the chat box. You may also unmute. You may also unmute your, if you're using Google Hangouts, you can unmute now and, let us know what you think, or if you want to share with us anything in particular. If you want to ask us any question that was, that you wanted more information on that we spoke about in the webinar, please go ahead and speak with us. All right. Thank you. We like that. You think we're awesome. That's awesome. We think you're awesome too. Let's see. Can you read?
Sure. So Annabelle says, in the Andean region, there is a postpartum ritual, Hualtas, a ceremony that focuses on returning heat back to the body. It is similar to La Cerrada. Do y'all know other similar postpartum rituals original to the people from U.S. occupied land?
Would you like to speak on that? Would anybody like to speak on that? Sorry. We should probably keep it further so we can all see.
Well, we are originally not from the U.S., so we wouldn't really be able to share with you, Annabelle. Unfortunately, we can only speak from our cultural background, like we mentioned earlier, the Nahua, Mexica, the Mayan regions. So to respect our northern native relatives, we cannot speak on behalf of them. But if anyone else here would like to share that information, you're more than welcome to join in on the call, or also add it on the, what is that called?
The chat box. The question and answer.
I hope this helps. Sorry.
Also, if you'd like to respond to us, you're welcome to. Let me select. I think that is.
Maybe we want to share another ritual. Postpartum.
Yeah. I don't think we need the mic. Okay. Well, do you know a postpartum ritual? Would anybody like to share?
Well, I know the mezcal is used for postpartum rituals in our regions. We spoke about it in birth, but also postpartum itself.
Right.
So that also brings back heat in our bodies.
Yeah, and also, we practice a cuarentena a lot. And the cuarentena, or in English, is called 40 days. So it's a 40-day where, it's the laying in, like you stay home with your baby. So some people practice the veintena, some people practice the cuarentena, and it's all connected to, you know, the cuentas or the calendars, the Mexica Mayan calendar. So it's a bit more complex, but just to simplify it, you know, it's a laying in period where the person that just had their baby and their baby, they stay in and they connect, and there's other rituals that happen during that time. The most common ones are for sure, you know, making sure that you're well nourished, that you're eating and drinking only warm foods and drinks and all that kind of stuff.
Right.
I have one more. I come from Jalisco, mainly. Also, my family is from DF. One of the things that is practiced in my family, in my region, especially in Jalisco, with my family from Jalisco, is after having the baby, for the mother's first shower, we get a big pot, like one of the ones for pozole, you know, a big one, the pretty much the biggest one that you can find. And what we do is a rosemary bath, and that, from what I have been taught, really helps out with the inflammation of the body, and also to return the heat back. And it just gives the mother such a sensation of being just showered with love. The essence of the rosemary is very refreshing. So that's one of the things that I was able to do when I had my daughter.
Yeah, baños are really good.
Baños and the bajos are very important.
Right. Right.
Hopefully this answers
Let's try
your
to get
question.
everybody.
And so moving on.
I'm gonna make something for them.
Okay.
So
So the next one is, this is my first pregnancy and love this webinar. Thank you. It really made me think about doing everything naturally. Is there anything I can do now to make this birth process easier?
I would recommend that you focus on your breathing, you know, like every day. With my doula clients, I always encourage for them to do morning pages, you know, to like wake up in the morning. And I know that we're always so busy, we're always on the go. But self-care is very important when you're pregnant. Like, you know, if you weren't pregnant, then if you get a massage once in a while, that may help you to get through the year even. But when you're pregnant, like, self-care is very important. So one of the things that you can do is, you know, wake up in the morning, you know, make your tea, you know, red raspberry leaf tea is really good. So you can make your tea with honey and then just kind of like sit for like, even if it's just a minute of just like free writing and just write whatever comes up for you. And throughout the day, you know, just really focusing on your breathing and just really paying attention to whether you're breathing shallowly or like whether you're breathing very deeply. So breath is very, very important in your labor. Do you want to add anything, Marta?
I think you said one of the most important ones that I helped me a lot in birth is the journaling and processing those fears you have of birth, and knowing that you are diving into the unknown and sometimes unexpected things happen. So learning to let go is very key in life and in birth. So just, you know, let go of those fears, let go of even expectations, and tune into your body. And so breath is really important as well, to tune into your body, to, you know, just get some sort of quiet time to tune into your body, your baby, and your birth process.
A great book that I would recommend that has amazing that it has amazing prompts is Birthing from Within. That's a book that I used in my pregnancy, and it just helped me to not only check in about the birth process, but also my mothering journey, right? Like, because I think there can be a lot of fears that come with what is my life going to look like after, and those things can also impact your birth. So, you know, kind of doing that work of reflection, self-reflection as part of your pregnancy, on top of the prenatal care, you know, taking care of your nutrition, herbs, and creating, you know, self-care rituals for yourself. I think the self-reflection piece is the one that we talk about least in terms of preparation for pregnancy or birth. And that can do wonders for how you're able to release in birth. So I would really recommend Birthing from Within by Pamela England. When we follow up with you all, we will also send resource lists with books and links and all that good
Bunch of stuff.
So yeah,
regionally, but also statewide resources for you guys.
Right. So I mean, so that's a really good resource, and we'll try to also bring up some prompts and other resources in our blog site as well. All right.
Thank you, Victoria. That was from Victoria.
Awesome. Next is, how about the Romero Baño from Jalisco? Is it a steam or bath? Sit bath. Thanks for this info. This is from Dora Martinez.
Okay, sorry about that. I should have been a little bit more specific. The way that I was taught to use the rosemary bath is after boiling the water and letting the rosemary sit there. You wait for it to be, warm enough for you to take it, and you pour it on your body with a little cup, whatever it is that you have available. And you do this after you take your shower. So that way, that's the last thing that goes on your body, and it becomes almost like a cleansing entity within the body and relaxing as well. So when you're done with your shower, your first shower, go ahead, turn off the shower, and with the bucket or pot inside the shower, just go ahead and start pouring it on your body. You could also pour it in your hair and just enjoy the experience. That should be very relaxing for new mothers.
And a lot of our traditions are very what are now considered holistic. So there's definitely a deep relationship with mind, body, soul, spirit, as well as plants and animals and energies. And so whenever you're giving yourself an herbal bath, it's also really important to set intention, and give thanks, for Mother Earth, or for the earth, for allowing you that opportunity. And with the spiritual baths that happen in the postpartum period, they're very useful in helping you to release excess air, and so and these airs can be like sadness or grief or anger or it's pregnancy and birthing is such a beautiful and sacred experience. And so part of giving yourself these baths is definitely to help you to let go and close that cycle, this beautiful cycle of pregnancy and labor and birth, and helping you to welcome this new beginning, into parenthood and having a baby and and all that.
Definitely, it's so beautiful and empowering. Let's see.
Thank you, Dora.
Awesome. All right, let's ask this question from Lena. As far as birth process, exercise, and diet are super important, get them squats in and eat them greens. Yes.
Thank you, Lena.
Squats are really good. Yes. Movement is really good. So those are all very, very, very powerful points. Yeah. The more you're comfortable with your own body, because it's different from when you were not pregnant, right? So the more you're comfortable with your body in your pregnant body, the better the transition will be during the birth process. So yes, squats.
Open up those hips. Yeah.
Open up those hips.
Yeah, spiral.
Get ready, spiraling.
Spiral, belly dancing, cumbias.
Do all that.
Twerking it, whatever works. whatever works for you.
So yes, thank you for your comment.
Thank you, Lena.
As Angela
just select it.
Yes. I'm trying to. Okay. Hello, Angela. Hello to you too. Thank you so much for acknowledging our work. We appreciate you supporting us.
Thanks, Angie.
Yay.
Lots of love here,
Okay.
Sending love to all of you. That's, participating and watching.
Thank you so much for making this awesome. Let's see. The next comment is also from Lena. during the birthing process, there are many herbs, massage techniques, and acupuncture you can use as alternatives to Pitocin. Yes,
Right.
there are herbals that can help induce. Yes. Can you share some herbs, tinctures, techniques you all have used to assist in labor? I personally used blue cohosh and black cohosh to induce my labor. I went to the very end of my 42 weeks, and that was actually it was effective. The contractions were a little, they were a little different, but I was just very clear that I didn't want to be induced because that became an option. What are other herbs that you've used with your clients?
Well, I haven't used herbs, but sex and nipple stimulation really helps.
as well.
Orgasms.
If you feel uncomfortable touching your body, you could totally get a breast pump, because
Yeah,
if you
it
could totally
works.
get a breast pump, a manual one, and use it, that'll stimulate. But sex is also a great alternative to induction. So thank you for that. Thanks, Lena. Let's see. For Annabelle's question, yes. Several tribes practice warming food, staying in, and having a fire burning in the home. This is by Bianca Tema Mercado. Thank you. Thank you for sharing a little bit of other rituals and practices. We'd like to speak more on this and inform ourselves more on different cultural rituals as well. Thank you for that. Let's see. Would you like to read one?
Sure. This one says, and it's from Natalie Solares. Thank you. I watched this with my boyfriend, and he says, thanks so much for doing this. As a self-identified hombre, he's appreciative and very aware of the value of you badass mujeres doing this jale.
Oh, thank you.
Thank you.
Thank you. This is beautiful to share with your partner, to become prepared in the birthing process. Thank you for sharing
everyone.
that. And everyone.
It all starts in the womb.
Did the webinar begin already? I'm not sure. The internet connection isn't the best. Yes, we apologize for the initial technical difficulties we had. And so, that might have been the source of confusion, but we got it on board now. And this is only going to help us to get better in the future. So thanks for checking in with us on that, Erika. Also, thank you for this. Heart you all. Y'all are awesome, by Annabelle. Thank you. You are awesome too.
Thank you, Annabelle. I know you're somewhere, you're back at home. I'm sure you're doing really amazing work out there. So thank you for tuning in from, Chile or Peru.
Wow,
she's somewhere out there.
Beautiful. Transnational connections. I love it. Thank you so much. I think that's all of the questions we have so far. We also wanted to mention in the models of care, we also wanted to mention the holistic and midwifery model of care. We did speak on that in the rest of the webinar, in terms of what kind of care midwives provide. So really at the essence and the core of that is that midwifery model care is integrated care from, not just your pregnancy, but all of who you are as a person. Would you like to speak more on midwifery model of care?
Oh,
our student midwife in the house.
I feel like you shared a lot of it. I mean, I guess I'd have to say I'm biased because I'm a student midwife, so I love midwifery care.
Yeah, exactly. I would like to say that midwifery model of care is one, they provide a lot of resources. So if you have issues that may not be necessarily pregnancy related, they're great at offering referrals and resources and just sharing more the emotional aspect of birth, right? Like that's integrated as part of the care. Which makes it very similar to holistic models of care, right? So we just wanted to add that piece because we know it's important, and you'll hear from us. You'll continue to hear from us and continue to form your own ideas in your research. But also please follow the blog, subscribe to the YouTube channel. We'll continue to dialogue with you all in this format and also in community in Los Angeles. So thank you so much for creating this space for us. We have one more question by Angela Flores. From your own experience, what has worked successfully for those who have had trouble conceiving? Does anyone like to speak on this?
Well, I feel like, in my experience, and what has worked is definitely, trusting in the process, and there's almost somewhat of a surrender that has to happen, just like when you're surrendering, or you're going deeper into your meditation, when you're in labor, and that also happens with conceiving. It's almost like there is such a deep connection that is needed, for you to have with your body, but also with your spirit, and with your womb, and so that also means like really trusting in the unknown, and trusting that everything's gonna work out the way it needs to, when it needs to, and if it needs to as well, sometimes thinking about it so much or overwhelming yourself can cause a lot of anxiety. And so anxiety causes a lot of stress in the body, and a lot in the womb as well, So I've had a lot of clients who are like, I try to get pregnant and then I gave up and then they got pregnant. Like,
I've heard that a lot.
Letting go of that, right? And I think also one thing to mention is womb massage, right? Sometimes the placement of the womb is off.
Not ideal.
Right, and for conception, right? So I've heard that womb massage and aligning your womb might assist. Also, I heard, or actually read on a kind of creation story about the kind of honey that Mayan bees provide. Now, this is in a codex. Which codex, I don't know. I will get back to you on that. But the kind of honey that specifically Mayan bees provide also have a lot of amino acids that promote fertility. I don't know if this is true or if there's evidence around it, but that might be helpful. That is a Mesoamerican way of promoting fertility. And it was actually often given as a gift for dowry or in asking for union within that culture. So that might be interesting. Might want to try those options. And I hope that answers your question.
And taking care of your body, your womb, and keeping other things that might be affecting your womb, to keeping it healthy and optimal for birth, because that's when conception is very like more possible when the womb is healthy and it's ready to give birth. Our body knows when it needs a baby, when it welcomes that baby, and it's usually when you're in your optimal health.
I have something to say. Real quick, touching up on the bees. I have heard that there is something very special about bees.
The bees,
in particular,
they're so sacred.
in particular Mayan bees, as we can see. But according to traditional Mayan spiritual guide, a scientist and gatekeeper of knowledge by the name of Humbatzman, he teaches that the bees actually have a very deep connection to the planet Venus. I would have to do a little bit more research and see exactly what that connection is, because he mentions it briefly in one of the videos that he has available on YouTube. But that is definitely very significant because of the energies that Venus has upon the human body, especially the feminine energy that, to a degree, we all carry.
Right.
Another thing that I was taught as far as how to follow your fertility, this is something that I actually learned when I was in school in Jalisco. I had a wonderful sex educator teacher. And she taught us to follow our fertility actually by the color of the discharge of your temple, your womb. And what was taught to me is that the discharge, according to the color and texture, you can tell whether you're fertile or whether it's high or low. The way how you can tell is if it's clear, almost like, I don't know, like water, like hair gel, kind of like the hand sanitizer texture, and that clear color, that means your fertility is high. the clearer it is, the higher it is.
Yeah,
And-
ovulating.
Yeah, and then if you, on the other hand, notice that your discharge may be white, like milk, like the color of milk, or like almost the color of school glue that we're all familiar with, that means that your fertility is actually low. So
Or you're having transitional.
yeah, or you're having a different transition within your body. But those are the ways that I was taught. And actually, the only time that I ever neglected it in my life, I ended up getting pregnant. So.
That's
No.
not good.
There you go.
So there
Also,
it goes.
so there's a few more resources. So check out Conscious Conception. You know, our ancestors, our people, still to this day practice conscious conception. There's more of a traditional way of course, you know, but there's a lot of, you know, contemporary, modern information, you know, out there. It's called conscious conception. It's whole like 6 months before, you know, conception. There's a whole like rituals like cleansing and, you know, meditating and all that stuff, you know. Also, you know, as a spiritual person, I can share this, that you know, connecting with the spirit of this baby that you're invoking, that you're calling in, and really like praying, like setting up an altar, and really like see, there's a lot of power in seeing. So seeing is believing. So really see it, you know, and really believe that it will manifest, you know. So hopefully this helps. Thank
Yay,
you.
thank you. Thank you, Ankala, for asking us this question. It's very important.
Do you want to read some more?
Yeah, do you want to read?
Oh, I want to mention something. Are you reading another question?
Yeah, we're reading another question. But that's why we have the blog, so we can get back at you.
Thank you for doing this work, and to all the future midwives and birth workers, welcoming the new generations with loving and healing hands. Shout out to all my savages watching.
And that is from
I think that is, yes, Lena.
Lena. Thank you, Lena.
Thank you, Lena.
Are you a birth worker? Just saying.
Next question.
Because if you're not, consider it.
You know, we need more birth workers.
We do
in
need
this
more
world.
women of color, Indigenous, culturally competent birth workers, of course.
Would you like to add something, Sipapi?
Yeah, not in regards, you know, to what is being mentioned right now. I just want to mention that we did just list a post on our blog where you can go ahead and just leave feedback, comments, or any questions that you may have about the webinar or this topic in general. So it's on our blog.
Yes.
Be sure to comment or message us, and we will go ahead and try to get back to you as soon as possible. That's all I wanted to mention.
Yes, the blog.
The blogs.
Okay, let me-
Okay, Ola, if there is a time, I would love to hear how you as birth workers, what self-care practices do you all practice for yourselves? Blanca Mama Maiz. Thank you, Blanca. So I'll definitely can share, you know, since I'm like, sometimes I'm like at 2 births in one day, and so like, let's keep going. You know, but then there's times where I'm like,
Anyone giving birth?
Anyone, but it's like they all like come at the same time. But you know what? It's all right, because we are very resilient, you know. And the way that I see it, you know, midwifery and being a birth worker is a calling. And so, you know, if you're called to serve pregnant people and you know, and hold space for them in birth, you know, then you must have a very strong and resilient spirit. And so I allow myself to be led by my spirit, you know, and I really trust it and listen to it, you know. And so there's always a communication, you know, that happens with spirit when I'm at a birth. And so and that's more on a spiritual level, but on a practical level, you know, it's making sure that, you know, that you're drinking enough fluids, you know. And so, you know, making sure, as you know, if you're at a birth, making sure, like, you know, what we do is like, we're always like, here, you know, have this. We don't even ask them. We're just like, here, drink, like drink. You need to drink. It's not the IV, you know. But as you're doing that for your client, you know, you're also doing that for yourself, you know, making sure that you're drinking, you're having small bites, I take my cooler, I meal plan has saved my life, like one day out of the week, I'll like just, cook a lot of food and then just have it with me, The other thing that I like to do, I work with herbs a lot. And so I give myself baths, these herbal baths that happen. Usually, if I'm like, ideally I'm home and then I get the call to leave, like I give myself a bath before and I give myself a bath after as a way of grounding myself so that I can prepare my warrior spirit to like enter ceremony, of course, when I'm at a birth, right? So that's like, a ceremony, but also like to kind of let go and close that cycle is, I also give myself a bath of, it's more of a releasing bath. And I have, healing arts, teachers that I see every month. So I'm like always getting like craniosacral or Reiki or, I'm going to ceremony, ceremony is very important for me. And so I'm like always like every 2 weeks, every month, like I'm always in ceremony. But on a practical level, it could be a 15-minute massage, Do you want to add anything, Marta? No? No? Hopefully this answered your question. There's so much more, and I definitely want to do a workshop on this.
Oh yeah, that would be great.
So
Definitely, because it's something that I'm really working on. It's something that I struggle with, making time for the self-care, because I feel so pressed for time that I'm like, oh, I gotta do this, I gotta do that, and sometimes I only get half the things done. So I've come to realize that making, even if it's 20 minutes, 30 minutes, an hour, just for yourself at whatever moment of the day is convenient for you, it really goes a long way. Yoga, breathing, or reading, and breath. Just the ever present communication with whoever you believe to be your creator, whatever name you call the creating energies back. A constant, I can do this, I'm okay, thank you. That constant feeling of gratitude for life is self-care within itself, and then it just spreads.
Yeah, I do want to add something. It's these women right here and other mujeres, right. The checking in sometimes, when we're feeling down. Like, I think that's a form of self.
Having a support,
having a support system, that's very helpful. And prayer.
Yes, prayer. Thank you so much for this.
Is it Blanco?
This is Blanca Diaz Mama Maiz.
Mama Maiz.
Thank you so much. That was so important to share. And even for mothers too, not just birth workers, right? Because we also need that time for ourselves. From Bianca Tema Mercado. Felicidades, mujeres. My heart is so happy seeing your beautiful brown faces. Thank you. Here on this webinar. Tiawi.
Shout out to Tema. She's a student midwife, birth worker, a mama warrior out there in San Diego. If anyone's tuning in from San Diego, definitely check her out. She does amazing workshops, and she does doula work, and she's a student midwife, and she's badass. So check her out, and she has a Facebook and Yelp, I think. She has on a website. She does a lot of things. Check her out. Thank you.
Link with us so we can put you on the blog as well.
And your birth stories.
Yes, and your birth
Share
stories.
your birth stories as a midwife.
Would you like to read one? Anybody else would like to read?
This one's Jenny Silva. Beautiful presentation, hermanas. The more knowledge the mujeres have about the birth process, the better our generation will trust the journey. Tlazo Kama for putting this together. I will definitely be sharing this information and docs with my clients.
Beautiful. Thank you. Thank you for that.
And, shout out also to Jenny. She's an amazing mama, warrior, doula, just here, we're so privileged to have her here locally in Los Angeles.
Beautiful.
And congratulations to your pregnancy as well.
Oh, congrats. Beautiful. Next one is from Dora Martinez. Any words, teachings on chocolate in birth?
That's a really good question.
That's a good one.
So, chocolate or chocolat, or chocolate helps to create oxytocin in your body. So it's an excellent drink to have during labor. And I was taught this by a traditional midwife that I studied with out there in Veracruz. And so it's a mixture of chocolate and even, regionally there'll be different herbs that you can use, but like, you can use chocolate, pimienta negra or entera. What is it called? Peppercorns. Peppercorns, clove, anise. I don't use anise in it. I use that in postpartum. Do you use that in birth for chocolate? We all have different recipes.
Right.
Hojas de aguacate, so avocado leaves and romero. All helps to create warmth in your body. It makes you feel really good. I mean, who doesn't love chocolate, right? So that, is given to a mom or a, pregnant parent in labor, but at a very specific time, so usually, and it's also really important to note that if if you are yourself taking herbs, during labor, or even if you're trying to start labor, it's really important to know that at the end of the day, whether you have the herbs or you don't, that you did this,
Right.
that your body was the one that was able to birth this baby, and that's something that the midwife taught me to always tell my clients, that, you are the one that has all the power inside of you and all the wisdom inside of you to birth your baby.
Right, so true. And to also talk about
Canela.
Canela, yes. And also to talk about chocolate, because when I was at my post date, or like when I got to my due date, actually, the blue and black kohash tea was so, it was just it didn't taste good to me, that I would include it with a chocolate. So I would drink it as a chocolate, and it kind of masked also the flavors. So if you're going past your due date and also want to use chocolate in that way, I tried it, it helped. But also if you can consult with herbal consultants, herbal practitioners, that information might be helpful to see, do your research basically, and consult with people that you would respect and trust.
Yeah, for
right?
sure. I mean, especially when it comes to like, induction, like it's always, recommended for you to like check in with someone that is professionally trained in herbs and knowledgeable, because, there are some herbs that are very intense,
Right.
and there are natural ways of inducing your labor, but with everything, there's like a positive and a negative. So there could be consequences. So, we want to share this information for educational purposes, and so always consult someone who's professionally trained, like your doctor, your midwife, or, someone that has a lot of knowledge about this as well,
Yes.
Thank you.
Thank you so much, Dora Martinez. And our next is from Mujeres de Maiz.
Yay, Mujeres de
Yes.
Maiz, shout out.
Shout out, thank you, Mujeres de Maiz, for supporting us in this process. First, so this is the comment. First, we are so thankful and appreciative to have you, sisters, sharing this important knowledge. It is such a gift to us all, and we are glad so many are tuning in, especially the other birth workers. Hearts, Mujeres de Maiz. Thank you so much.
Thank you.
Oh my goodness, yes.
Yeah,
Thank you so much for everyone.
And we feel very honored, Mujeres de Maiz, y'all are a very strong force of, badass women, and thank you so much for all your hard work that you do, for like many decades now, and I think a lot of us have grown up, and keeping it real, like growing up in this beautiful lean, this beautiful movement, and you all have definitely doulaed us,
to get to this point. Yes,
so
beautiful. Thank you so much for this. All right. If there are any more questions
or videos, can people like
yeah, I wonder how can are people yeah, I don't see how we can do that.
I think it's just questions.
I think we just have a question. Another question. Yes, Mujeres de Maiz. Regarding other topics in question, can you share some about teen and or older pregnancies? Perhaps Martha share about womb to tomb work. Beautiful.
Okay, so began as a birth worker, but then my journey took me to other ways of doulaing. And so one of the ones that I have recently completed was doula for the dying and conscious living and dying. So this is what I'm right now has been my major calling, is doing that work. I'm also studying to be a death midwife. So doing home wakes is another option that we have here in California. So this is a lot of the work that I've been doing recently. And just like in birth, death is very similar. Like it's a lot of fear, a lot of letting go, because we tend to forget that we're spirit, and we become really attached to our bodies. And in death care, or the death of our bodies, but the rebirth of our spirit, then part of our spirit in another realm, it's really important to acknowledge our attachments and our fear of letting go, and to again dive into the unknown.
Right. It's beautiful. It's such a beautiful calling.
And just in all spectrums, Tisicali has been a support system, and to all these transitions that are very important in our lives, how scary and fear-based they are in this society, and how it brings a lot of us into these very dark places. And so that's why in community, it's really important to honor each and every transition, and how it's, change and transition, and how letting go is, again, very difficult, but important, because we let go, but we gain something as well.
Right.
Set transformation. So powerful, because I really do feel like birth and death come from the same source. Like there's like this unknown force, and I definitely, have, supporting, pregnant people and birthing their babies, and also holding space for, for loss as well. I definitely feel like there is this unknown element. Like I feel like it comes from a very similar source. It's a very powerful one. So to continue answering your question about teen pregnancies. Well, I feel like it really, fertility awareness and really, getting to know your body, I feel like that even begins in the womb, because you're modeling that for the fetus, for your baby, and so, and then you teach that, you teach fertility awareness, and you teach like body consciousness, and you teach about like how to connect with your body, and how to set boundaries, and how to embrace all the sensations that your body feels, and so I feel like, with teen pregnancy, honestly, I feel like I know some really beautiful, fierce parents, mothers that are, their journey to parenthood or motherhood began when they were teens, I think it's really important to empower, folks that end up, getting pregnant, right? When they're teenagers, and really, holding space for them and teaching them. And I feel like, it's important, for us to teach autonomy, and to, and to help, the youth get to a place where they're making a conscious decision about their bodies, and unfortunately that does not happen a lot of the times. And I think, in my experience, teenagers, because I've also served teen mothers, they have gotten pregnant because they were not aware, and they were not in tune with their bodies as well. So that wasn't really coming from an informed choice, right, or consent,
This is not taught in the schools or in the media. It's like our responsibility as community to also help empower these young mujeres. And the young men as well, they're also creating.
And all those, also the gender non-conforming teens as well.
And having, once they do get pregnant, like having that support system as well as community, not shaming them. And they are, no matter what age, they're capable of being awesome mothers with proper support.
Yeah,
for sure.
Definitely. Yeah, definitely. I have seen that within my family, and there was a lot of shaming upon those women. And I definitely think that, after they realize that, you know, the baby's here to stay and that it's no good to shame anybody.
Right.
They did start supporting, but I think the most important thing, no matter if you're a teen mom or already in a later place within your life, it's all about monitoring your health, becoming informed, and to make sure that you have a tight support system, so that the people that are around you are treating you with love,
Right.
and
Everybody
that,
has love.
yeah, and when the baby comes, you know, you're gonna feel, the teen moms or any mom can feel emotional or confused. So, and definitely, maybe we should think about developing education for parents of teen parents, and just giving them resources to, you know, for in managing their temper, their communication, and the sexual education of their children and grandchildren.
Right, right. Would you like to speak on older pregnancies? Would you like to talk about that as well?
Oh, another, in terms of resource, here in LA, the RJC, don't they have a teen mom or teen pregnancy program or something? Teen parents?
I don't know, but RJC?
For productive Latinas for...
Oh, yes.
Yeah, they have that.
Center for... I don't know that. I'm sorry.
I'm so bad with acronyms. I'm so sorry.
But if anyone knows about this, please link us. Also, we can go ahead and link that as well. CLRJ is acronym. I do not remember what it stands for, but they definitely do advocate for teen moms.
Yeah.
Especially the messaging, the advertisement that even the public health department provides on teen parenting is really shameful, about how they totally shame parents and totally target also teen parents of color, right? And so the CLRJ definitely advocates for teen parents, fierce teen parents, that they just need support. All parents, all families need support, and I think teen parents especially. So we'll try to link up and try to get that more information on that as well.
Yeah, and Ruth Beaglehole from Echo Parenting.
Yes, thank you, Annabelle. California Latinas for Reproductive Justice. Thank you.
CLRJ.
I got the acronym right, but
I know, I'm just like, what?
But yes, thank you for that.
So, so like I was saying, Ruth Beaglehole from Echo Parenting and Education, she created a curriculum for teen parents, and it's all about nonviolent communication and parenting and teaching, from a place of empowerment.
Right.
So hopefully that helps. So, going along with...
Thank you as well, Patty Garcia.
Oh, thank you,
Yes.
Patty, tuning in from El Paso, I imagine. Congratulations. I think you're almost done with your midwifery program at Maternidad Luz. So, congratulations, and we honor your work. You're, an amazing person. And so, adelante, So going back to older pregnancy. So I feel like it really depends on the school of thought, I feel like if you go to an OBGYN, or if you feel like, and, if you go to a nurse midwife, if you go to a direct entry midwife, if you go to your tia, or you go to, your neighbor, like, I feel like everyone's going to tell you something different, So I think that, so I can speak from, as a student midwife and really, working from the midwifery model of care. That's not when you are of a certain age, like, that's not necessarily a risk factor for us, that can be, right? But that's not like the determining factor whether you're a high-risk pregnancy or not. And it may or may not necessarily mean that because you're a certain age, you're going to have this and that, or you have these, you know what I'm saying? Right. Like, and so it's not really much of an issue, I have witnessed several, and I've worked with like Mayan women, like straight out like Iche here in the community, and like in their 40s, they're 45 and birthing healthy babies, and I also work at a birthing center, and so there's definitely, a lot of our clients are, over 30 and they have healthy pregnancies, and so it's it's really more, I would say, in my opinion, it's more about, you know, how you take care of yourself, stress levels, the type of life you have, because, you know, you can be 17 and have gestational diabetes, you know, because you're eating hot Cheetos every day and Coke, you know. Or you can be 40 and be like vegan, or, you know, eating only grass-fed meats and, you know, like organic alkaline water, whatever, so, you know, like, and, you know, and so that's really not much of an issue. Now, you know, there's definitely other tests that you would take, you know, because according to the state, you know, and if you were to go to an OBGYN, they would tell you something different. So I would say I like to work with spirit and intuition, and I would say really trusting your body and trusting the wisdom that your body and that your spirit has, and should this spirit come your way, you know, to embrace it and welcome it, and also allow yourself to surrender to the unknown and whatever may be coming up, you know, and to embrace the process. And I always tell my clients to really focus on what's working rather than what's not, you know. And sometimes we focus so much on what isn't working, or, you know, what if because of this I can't do that, you know, rather more like really working on your strengths, you know. Anything else you want to?
I think you pointed it out, the whole healthy lifestyle, reducing your stress. I've known, like you said, a lot of teens or younger women that have preeclampsia, gestational diabetes, things like that. And I mean, I gave birth at a quote unquote older age as well, especially my first one. And so I had no issues whatsoever. So it's just.
Yeah. And I think that there is a stigma. So I think just really being aware of that, and also like, you know, having like setting clear boundaries and intentions, and only being around. And I think regardless of age, I think just in general, when you're pregnant, like really like being very intentional about who you're around, and like being around people that believe in you 110%, you know what I'm saying?
And you believe in yourself and have that trust.
Yes.
Because people are going to tell you you're too big, or you're too small, or you're too whatever when you're pregnant.
Just very important to trust your intuition.
Trust your body, you know. And
and
also, you know, like if anyone out there, regardless of age, is planning on a conscious conception, really look into that and really seeing, because if maybe you feel like you're not as healthy, you know, the whole conscious conception and fertility diet like that, you know, working with herbs. And, you know, I have several, you know, friends and clients who plan their pregnancies, and you know, they had like a lot of rituals and self-care practices that they did for them to get to a place where they felt like mind, body, soul, spirit, like grounded, you know.
Preparing everything, not just one thing.
Right. Thank you so much. Thank you. All right. Now the next questions we have. I think this may be close to our last question.
The last one.
Well, we have like 15 more minutes. It ends at 9.
Oh, that's right. So, Dora Martinez, my homegirl Yvonne wants to know, are there any traditional baby showers? Would you like to share?
So, you know, from what I've learned from my Kalpuli, you know, my, I guess the translations are like not the best, but like, I guess spiritual community, is that traditionally you would have ceremony for the mother, and you would bring gifts for the mother, and so, or the pregnant parent. And so like a lot of the baby showers would happen after the baby was born, and after, you know, you would do, you know, the presentación, where like, you know, so you would have the cuarentena, and you would like kind of lay in, and then you would do the presentación, and you would do the ceremony, would like be like, here's my baby, you know, and like, you know, like directions and all that stuff, and then people would bring gifts and like more so like offerings, you know.
Right.
So we've tried, you know,
for Messi's birth, we had the mother blessing, honoring myself and my baby and my family when I was pregnant, and like Maria said, a lot of the gifts are for the mother and honoring her transition into motherhood, and a lot of self-care or postpartum care. items are presented, and the baby shower, the presentación after the baby's born, after the cuarentena, then it's, it focuses on the family in general, but also in honoring that new life that has come.
Yes, I agree, and I think there's very many ways to do a mother blessing. Yeah, I had my first baby. I had more of a danza mother blessing. It was really big, and there was a lot of danza. It was very beautiful ceremony. For my second mother blessing, I chose to do something more intimate. I did birth art. I had a belly cast, and I invited my closest clan to like just come and paint the belly cast, and that was really beautiful. It was really small scale. So it's different. There's different rituals. There's different ways that you can plan it, whether you want to incorporate birth art, danza, you want to have it more mother focused, or you want to wait till the welcoming ceremony after. There's very different ways of doing it, and the beauty of it is that you get to choose, or you and your closest around you can help and support you in that process. And so would you like to share as well if you've seen any other different type of mother blessings? Or
No, I feel like I don't know, I feel like we shared a lot of it. I mean, a lot of what I've helped has been yours, and as well as ours, and other mujeres from Tisicali as well, really holding space, like Cristina and Diana.
Yeah, and belly painting, right?
A lot of art,
some belly painting.
So I tend to do a lot of prayer and songs and in Xochitl, right?
In Xochitl,
setting intentions for the
right,
birth, for the baby.
And birth and pregnancy is such a creative force that it really lends itself to birth art and that kind of thing. Like there's just because creation is in you. It's just it's really a creative force. So work with that energy. It's such a creative energy. Would you like to share about mother blessings or?
Let's see. Well, I just want to share that however you want to welcome your baby into the world, whether it's before, after, or before and after the baby arrives. The sister was saying, it's just such a great opportunity to be creative.
Right.
One of the things, if I may share a little bit about my own baby shower, my mother's husband and her, they actually somehow got to, I guess, purchase or something, butterflies, like real life butterflies.
Wow.
And they came in a little box. Everything is supposed to be safe, eco-friendly, because they know how I feel about Mother Earth and its beautiful creatures. But what we did was everybody got a little box, and there was a butterfly in there. And we passed out a handout that said, in some tribes, the belief of the butterfly is that if you have a secret or any type of wish or anything like that, you will whisper it to the butterfly, because the butterfly doesn't talk, and it will fly with a message to Creator. So we gathered up. A friend offered some music on the traditional flute. I apologize, I don't know the name. And then everybody made a wish and then released the butterflies. So your welcoming can be anything you wish, anything that speaks to you, any type of celebration. It's beautiful.
Yeah, that's so beautiful. I love mother blessings. Let's see. Thank you for that, Dora Martinez and Yvonne, your homegirl. Let's see. Also, so Patty says, "Oh, thank you, ladies. Oh, that's so sweet." I think at this point, we don't have any more questions that are here. Please, if you want to ask us something,
We have 10 more minutes.
we have 10 more minutes for the broadcast. Until then, what can we offer?
We can offer the fact that we have opened up our blog for others like to share their birth stories, anything at all that is related to birth or pregnancy or parenthood. Anything that you think it's important that you would like to share, go ahead and reach out to us. You can email us or reach us via Facebook. And so far, we have posted the first birth story that was submitted to us. And it's a very beautiful birth story, so please check it out if you can. And we are also working on other sections that we will feature in our blog, stories of sisters helping each other, just any type of uplifting story that we can share, or that folks want to share via our blog. It's wide open for people to share their thoughts.
Yes.
Especially for people that are not so techie friendly, may not have a blog of their own, like me. This is a great tool that you could express yourself, share your stories, and empower other people in our community. And we could provide that space for you there.
Yes. And also birth art. If you have birth art and you had like doodles, you want to share journal entries, like resources as well, or ideas,
pictures,
all of that, we would totally welcome it. And it really, the blog spot can be what y'all share with us, as well as really whatever we want it to be, and like also include the resources that we would like to offer you. So to follow up, since I don't see that we're having any questions, to follow up, we will email everyone with the YouTube link of this webinar recording with a resource handout where we will describe the books and links and all that great stuff that we want to share with you all, as well as questions to ask your provider when you're looking for a provider. What other things did we want to share? We'll just look out for our email. We will follow up with you all. We really, really appreciate everyone coming in and joining with us. This has been a very beautiful process for us. Oh, we have one.
Mil gracias for your energy. Would it be safe for my baby to be
smudged with copal?
Oh, okay, because we got another one also.
Yeah.
I'm so confused.
Yes.
Would it be safe for my baby to be smudged with copal during birth or after birth? Yeah. So I I work with a lot of these traditional elements for with families that are connected to these ways, and so there's always like copal and the smudging and the really other spiritual elements, these beautiful traditional ways that I bring in to families that are that walk this way, so definitely you're welcome to burn the copal. And traditionally copal was burnt in labor and birth. It's very sacred. It's a very sacred element to your birth and peace. And thank you for asking that. That's definitely really important for all of us that are walking these ways or connected, to bring that, because birth is a ceremony, and what a better way to bring in your baby into this world by like adding these sacred elements.
Yes.
So thank you, Margarita.
Thank you. And also to mention, if you have a hospital birth, right, they're not going to let you smudge. But one of the ways, because I had 2 hospital births with nurse midwives, and one of the ways that I kind of underground brought copal in, I smudged a piece of cloth and I just kind of let it smudge itself. And I put it in my birth bag, right, in my hospital bag. And that was actually a tool that I used to help me breathe and ground myself, because for me that helps me ground myself.
Exactly.
And so I would get my cloth and I'd smell it and I'd breathe through my contractions, and that's kind of the way that I was able to bring ceremony and spirit into my hospital birth, because there are restrictions, right? as well as fresh sage. I use fresh sage to help with the breathing. So that, you know, there's ways that you can go, you know, for
in any setting.
In any setting, you can try to make it, bring it, even if it's underground, you know, try to bring it in.
And, you know, always make sure that, you know, someone is doing that, you know, taking care of the fire, you know, like having someone take care of fire, you know, during your labor and birth, whether it's, you know, like if you're having a hospital birth, like someone else can be burning that sacred fire for you, you know, or if you're having a home birth, you know, making sure that someone who, you know, knows about how to take care of the fire, of course, you know. We don't want anyone burning.
I got something to add.
And, you know, making sure that if you are, you know, burning the copal in, you know, in the poposhkomi, you know, in the copalero, to burn that, you know, the carbon outside of the house, you know, because you don't want to smell that when you're in labor. Just burn it outside, and you know, I'm sure you know this, you know, but just burn it outside, and then once it's like, you know, ready to go, bring it into the house.
Good point.
There was one thing I wanted to mention about this topic, and I feel it's very important to say that you know, you need to trust and practice your right to your cultural beliefs.
Yeah, that's so true.
With some friends in the community, you know, I have heard stories where the parents are actually like, "What are you doing with that smoke? And you're a bad parent, and you don't know what you're doing." And they just pour negativity over something so sacred and ancient to us. So I just wanted to mention that people sometimes they don't mean any harm. They're just uninformed about you know, our ways. And as long as the baby doesn't have any congenital you know, diseases or any malformations in the lungs or anything like that that could be serious, as long as your baby is healthy and you have a sacred space, please go ahead and practice it. And you might want to consider keeping that space sacred if there's people around you that you know are not familiar with the ways and may you know, maybe interfere with your personal ceremony.
That's an excellent point. Choosing your birth team and who's in your birth room wisely, right? Because it could be someone you love dearly, and that doesn't mean that you don't love them dearly. It's just you want to keep the intention and the integrity of your birth intact, right? And so choosing that wisely, and not being afraid to set those boundaries early on, right? So thank you for sharing that.
And also, you know, for all those, you know, that are having, you know, hospital birth, you know, that's been, you know, the right to practice our cultural, you know, ways, you know, is it's a bit challenging, you know, and so there's definitely ways to go around it. And I think that, you know, it's important for us to like come together, you know, as Indigenous people, you know, to like really like do that work, you know, and I think we can do that before, you know, like it doesn't have to be while you're in labor, you know, because we want you to stay focused on your body. But I think that that's something that, you know, we definitely need to continue doing, you know, like I think, you know, I mean, the fact that some of us can use the rebozo is like really special because, you know, the rebozo is very sacred for us, you know, it's a sacred shawl, you know, and so, you know, definitely, you know, talk to your care providers and talk to them before you go into your labor, you know, and, you know, back up your relatives that are trying to do that, you know, bring in these sacred elements, you know.
Yes. All right, we're done. Would anybody like to read? Next.
So this is coming from Patti Garcia. This was such a great use of media to connect us all, informative and healing. I appreciate all of you and your work and spirit. I have a lot of ideas about midwifery education, ways to support each other. Would love to connect with other student midwives. Yeah, beautiful. So if anyone, you know, out there, you know, myself included, you know, any other student midwives out there, you know, definitely, you know, we'll post something on, you know, on our blog about that, you know, so that we can continue connecting. So it's 9:00, and so, you know, we can maybe take one more question, but if not, we're done, you know. But So, my name is Maria. And I want to, give thanks, first and foremost to our ancestors, and to our relatives, and, to these sacred ways, that connect us, and to Mother Earth and the directions and the elements, and Ometeo, give thanks to Ometeo, for allowing us the opportunity to even be here, and and sharing this information with all of you, and we hope that you really, were able to get informed, and also like continue that dialogue with other people and with your community, and so I'm very grateful, to be here, and I give thanks to my community for helping me to be here, to be like a student midwife, because, being a student midwife means a lot to me, and I've had like 100% community support. So thank you all for supporting myself and as well as Tisikali, because we would not be here, if it wasn't for all of you as well. So thank you. Ometeo.
Ometeo, thank you.
Okay, so once more, I am Sipakli Oshlahun, and as always, just thankful for life. Thank you for, and just humbled and grateful that through the collaboration and through reaching out amongst each other, we were able to put this together. It was a brilliant idea. I feel, we had been, what would you say, MIA, missing in action for a little bit. So it's really a blessing to be able to take part in this. And this has really inspired us to keep putting things out there and keep sharing resources with the community. And I just really look forward to meeting mothers, birth workers, and anybody that is interested in this topic. And to finalize, I guess I would just like to mention that practicing or planning your birth, exercising your cultural rights is a part of us exercising our freedom again. These are ways that for a long time, for a long time, we were forbidden from even wearing our jewelry, our huipiles. It was something that was forbidden. Yes. So and now, as we move towards that freedom movement, this is included as well. So this is part of human liberation and exercising our freedom. So with that, I guess I just want to take one more second to thank Mujeres de Maiz for reaching out. And please be sure to follow them and keep updated with all the events that will be taking place. And also stay tuned for our upcoming workshops.
Yes.
Thank you. Ometeo.
Thank you, Ometeo. Ometeo, I'm Sarita. And I want to also I really want to thank this collective. Like Sipakli held it down with the process of putting it together, and just like all of us, joining forces, and the kind of resources that like are just so special to each of us that we shaped this webinar. I really enjoyed the process of building with y'all. So definitely, I really, 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 really appreciate that. And I'm thankful for Creator to have y'all in my life, and to have the type of space, capacity, and energy to be able to do this. I mean, I feel like, there was some pushing stages in creating this, there was a lot of
a birth.
It was definitely a birth, and there was definitely some contractions, surges. Yes. So, it was very beautiful to put this together. And just, thank you for tuning in and for being a part of this process. You did so awesome. Everyone that joined in, thank you for coming. And just like, I just love this. We should totally keep doing these.
Ometeo, thank you as well. Thank you so much for this honor. It's really been humbling, especially with this whole techie process, since I'm not really into this too much, but I've learned a lot, and I think it's a great tool for information to be spread around, the world in general, and to keep us in contact as humans. And just in that, also, I will be posting more information on the whole womb to tomb care and transition, because that's my biggest passion is transitions and mental health, especially women's mental health, and how, you know, during those transitions, those are the scary moments, that the dark times that women and most care and the most support, and in the society we don't have that time to like chill and to take space to breathe and reconnect with ourselves. So I will be posting more on that, and I know we all need a lot of support in the death of our bodies and the rebirth of our spirits, and how that can be also possible through Tisikali and through community itself. So thank you so much for the opportunity and what little we know, and, you know, connecting with all of you in spirit. Thank you.
Yes. Thank you so much.
All right.
You want to sing us off? Okay, I think we want to sing us off. You brought it up. You want to sing
I brought it up, so then we can start it.
Which one? No, let's do Classo Matli. No, yeah, let's
Bloopers.
Oh, bloopers.
No.
Yes. Let's do Classo Matli as a closing prayer.
Okay. You go ahead and start it.
Go? Yeah, okay. Okay, Ayakashi in the house. There you go. You can go ahead, girl.
All right, you say it, girl. You brought it.
You brought it?
All right. I brought it for you.
All right,
All right.
let's do this. Plazo cama, hey, 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 yo, mete, yo, plazo cama, ti, o mete, yo, hey, ana, hey, yo, hey. Plazo cama, ti, hey, 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 yo, mete, yo, plazo cama, ti, o mete, yo, hey, ana, hey, yo, hey. Plazo cama, ti, hey, 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 yo, mete, yo, plazo cama, ti, o mete, yo, hey, ana, hey, yo, hey. One more time. Plazo cama, ti, hey, 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 yo, mete, yo, plazo cama, ti, o mete, yo, hey, ana, hey, yo, hey. Plazo Kamati, beautiful. Thank you so much. And goodbye. Love you guys.
Like that.